Well, new this morning, we're learning some positive developments about the Omicron variant. Pfizer says its own research suggests a booster shot makes its vaccine far more effective than the standard two-dose regime. Tom Costello has the latest.
The new research from Pfizer is critical as the country tries to arrest the spread of the Omicron variant. Pfizer says its first two vaccine doses do not hold up well against Omicron, but the third shot, the booster, provides 25 times the protection against Omicron.
3 doses against Omicron are almost equivalent to the 2 doses effectiveness we had against the wild type, the original variant. These are very good news.
The bottom line, as the virus mutates, the booster may be the shot that keeps you from contracting COVID and staying out of the ER.
If you get the booster, you're really in good shape. And so that's very encouraging news.
But as the country enters its third COVID winter, many Americans have grown tired of so many virus, vaccine, and mandate developments. Yet this number is staggering. The CDC reports 787,000 Americans have now died from COVID, more than the number who died in the Civil War, America's deadliest conflict. 1,100 people are dying every day from COVID's Delta variant. 6 states now make up half the country's hospitalizations: Michigan, Ohio, Indiana, Pennsylvania, New York, and Illinois. Most patients unvaccinated, but some are breakthrough cases. Massachusetts is now coping with a third COVID wave. Trauma rooms at UMass Memorial 120% full. The staff utterly exhausted.
What we're hearing about people now is crying on their way into work, knowing what they're about to face. And that's what healthcare workers are going through right now. You're tired, but you're not as tired as the healthcare workers that have to deal with this crisis right now.
Despite the rising death toll, a new Axios poll finds Americans are eager to put the pandemic behind them. Only a third say they'll stop dining indoors at restaurants. Fewer than a quarter say they're canceling holiday travel plans. Just 28% will skip gathering with friends and families outside their households.
For folks who are not vaccinated, you are high risk of ending up in the hospital or the ICU, no matter how young and healthy you are. For the rest of us, with those vaccines, we can have an added layer of confidence.
As you may have just heard, Indiana is one of 6 states accounting for more than half of the country's recent COVID hospitalizations. Most of the states are in the Midwest. In addition to Indiana, Michigan, Illinois, Ohio, Pennsylvania, and New York make up that list. NBC News found that 60% of new COVID hospitalizations are in these states. And in Indiana, hospitalizations have more than doubled in just the last month.
The demand for testing has spiked in the last few weeks, but finding a COVID rapid test is now difficult. Many health departments are either running low or are completely out. Here at the Fishers testing site, they ran out about 2 weeks ago, now relying on PCR tests, which are considered the gold standard, but take about 1 to 3 days to process. So if you know you need a test before traveling, or your student is quarantining and needs one before heading back to school, make sure you schedule that appointment earlier so you have enough time to get those results back.
And now some hospitals are making changes. IU Health Arnett Hospital in Lafayette has opened up its ambulance bays, and they're using conference rooms to handle the influx of sick patients.
Governor Holcomb says that he's frustrated with what he calls the absurd reasons that some people have for refusing vaccinations, now calling it a pandemic of the unvaccinated. But he says the state will continue to encourage people to get vaccinated. But Holcomb says he's not mandating the shot in Indiana. That remains out of the question.
It is still up to you in the state of Indiana if you want to get vaccinated. That's why I took exception to the federal government coming in and picking different groups.
Holcomb insists that government's role shouldn't involve mandating vaccines, but to make the resources available to those who choose for themselves or their kids. Around half of Indiana's population has not yet gotten the shot.
Indiana's Senator Mike Braun is also against vaccine mandates, calling it an overreach of government.
And that's why he's backing the Congressional Review Act that's challenging the federal mandate.
Does any senator wish to change his or her vote? If not, the yeas are 52, the nays.
Even though Braun isn't in favor of the mandate, he says he still supports the vaccine and urges people to get the shot. The CEO of Pfizer is saying a fourth COVID-19 shot may be needed sooner than expected. That's because the Omicron variant can undermine protective antibodies generated by the vaccine. The statement came after Pfizer released results from a study showing how its vaccine works against this variant. The company says the initial 2-dose vaccine protects you from getting severely sick from it, but the booster really works against it.
Well, today, Avon schools, the day will look a little bit different for students there because the school district is once again requiring masks. That's because Hendricks County has been in a red advisory level for 2 consecutive weeks now. And under school district protocols, the second week of that red status for the county means that masks will be mandated again. The change also will help keep more kids in school since the mask requirement changes their quarantine requirement.